So I had a patient that she's middle-aged female, and she has had a lot of issues, a lot of neck problems in the past, and she's seen a lot of different providers for it. She's been through chiropractic care for a long time. She's gotten some relief, but it doesn't last. Things don't continue to work. And even though she had some traditional ortho done and got her teeth aligned, the problems didn't go away. She still had some jaw tightness, soreness, and some problems with her ears feeling a little full and occasionally some ringing. So all the signs and symptoms that I saw from when she came in to see me, it also looked like she had an underdeveloped airway. And so we tested her for sleep apnea. Results come back, she's got sleep apnea. And so we had the discussion with her about there's different ways we can manage this. And, we can put you on a CPAP to treat your airway. That's not going to help with the joint and neck issues, though. And she didn't want a CPAP anyway because she didn't want to have to wear that thing on her face. The other option is a sleep appliance and that we make in the office, and it's a custom appliance that repositions her jaw, and we put her in a relaxed state when we do that. So it is going to help with some of the jaw pain and some of the clinical things that I saw, but again, it's just treating the symptoms of what she has, not treating the underlying cause of those symptoms. So the third option that we gave her was doing a form of orthodontics where we actually reshape the jaws and help bring them forward and create growth. And by doing that, we create a larger airway, and we relax the position of the jaw as well when we're doing this and allow the jaw to go into a more neutral site. So we're able to address a lot of different things with that. And she, having had treatment and having had things done, she was looking for a solution, not just a treatment for a symptom. So for her, we've decided that we're going to do some growth. And the analogy that I like to use with patients when they have a small airway is, think of having a really thick milkshake and trying to drink that with a stir straw. You're going to struggle. You may get a little bit, but it's probably not going to be worth the reward. So we're going to give you a bigger straw so that you can actually enjoy that milkshake. You can breathe the way you're supposed to. So what we do to determine if she's a candidate for this type of ortho is we do a full 3D analysis. And so we take an X-ray that's three-dimensional, and we're able to look at where all of the bones and soft tissue are located and determine, okay, are we too small in certain areas? So we looked at her, we evaluated her, and we saw that we need to bring her upper jaw forward about almost a centimeter. And in doing that, we're going to give her the area that she needs, not just for her teeth to fit where they're supposed to, but her tongue to have the space and room to go where it's supposed to as well. And so we're working with her as well on some exercises to have proper tongue placement and have proper lip seal, creating the right type of breathing, because what we find with a lot of these patients are they breathe through their mouth and they're not properly breathing through their nose. And so we have to train them to breathe through their nose as well. So this was definitely something that was brand new to her. She had not heard of anything like it or seen anything like it, but when we were able to go through the models with her and show her what we were going to do and why we were changing the things that we were going to change, it made sense that where she was right now, everything was pulled back in really tight, and she just had no room to maneuver either her teeth or her tongue. So the best way to start this process is to make sure we have a proper diagnosis. It's like everything else in medicine. You're not going to go get your appendix out if you don't have appendicitis. You're not going to go have a procedure done on a torn rotator cuff if they haven't done the imaging to see that it's actually torn. So we make sure we diagnose these patients first instead of coming up with a plan that says, well, this hurts, so I'm going to treat what hurts. We want to know, why does it hurt first, so we know we're treating it the right way.